My name is Frank Godino, and I've been a parishioner here since early 80s, and a Eucharistic minister since the late 80s. And my profession is dentistry. I've been a dentist for 30 years, and 25 of those here in Dana Point. And I feel very blessed to be not only living here, but be a part of this community here at St. Edward's, that's where God's beauty is so apparent to us every day. So I feel blessed for that. I was asked to give a couple of dental tips. Can you get that over real quick? The two things I can really say, take brushing and flossing very seriously. Don't just get out of the way real quick and do it half-heartedly. It's very important, because if you get periodontal disease, they're finding also, you probably read it in the paper, all sorts of links to cardiac conditions and cancers and a lot of other things. So it's very important, just the inflammatory process that occurs because of it in the mouth, and as well as the bacteria that's in the mouth will get into the body, and they found bacteria that normally are only found in the mouth, in the heart, a number of places. So take that seriously. See your dentist twice a year. Make sure follow the recommendations. Another thing I wanted to mention about in dentistry, which you may not immediately link to dentistry, is sleep apnea. I don't know how much you know about sleep apnea, but dentists are actually in a great position to diagnose and help people get treated for sleep apnea, because one of the primary things with sleep apnea is loud snoring. So most people won't tell their physicians about it, but they'll talk to their dentist about it, and we can help to diagnose sleep apnea, which is a sleep-related breathing disorder where you stop breathing for 10 seconds or more in a number of events throughout the night, and also your blood saturation drops down at least 4% to be considered an event for an apneic event. And I had one of my patients actually, we found that he was not breathing more than he was breathing all through the night. So anyway, if you do have loud snoring, if you are overweight, if you have high blood pressure, a number of symptoms like that, you should really get a sleep study, and then either be put on a CPAP machine, which is continual pressure oxygen going, or actually just air being forced down into to overcome the obstruction that's in the back of your throat, where the upper airway has collapsed. Either that, or where dentists come into play, there's dental appliances that can be used for mild to moderate sleep apnea for people that can't tolerate CPAPs. Okay, those are my two dental-related tips. So what I'm going to talk about actually now is, now that you have a good idea where I came from, my business part now. So how does it relate to how I conduct my business on a daily basis? I kind of broke it down into business model you choose, how you treat your patients, how you treat your staff, and then other things that you kind of do out either related to your business or outside of your business. So the business model I choose a model where I can spend a lot of time with my patients. I never did like the HMO model or anything like that, where you're rushing people through and just conducting what good is practicing your profession if you can't enjoy the relationships you build with your patients and the people that you come in contact with. And I really believe that has been from my mom and my dad, just teaching me about people, and not even in words. It's showing me how they deal with other people. That I was born and raised that way. So I naturally want to do that, and that's the way I want to be living my life. And when I go to work day, that's how I want to be handling my patients. Is giving them the time that they deserve. So that's kind of the business model that I choose. How I treat my patients. I spend a lot of time with them. I try to get to know them as people, not just a mouth that has teeth that need fixing. I always treat them with respect, integrity, and honesty. These are things that are either in you or they're not, I believe. If they're not in you and you're trying to just falsely show them, it'll show through. I fully diagnose what needs to be done to the best of my ability. I present the findings to my patients, along with ideal treatment plans and some alternative ones. I understand that not everyone is just going to, accept whatever you say. You have to explain things to people, you have to show them why, you have to earn their trust, and only then really will they learn to trust you, that what you tell them they need, they will do. And even sometimes they can't do it, sometimes they can't afford it, so I give them alternatives. I prioritize treatment for them so they can at least get something done little by little, and we work through it. And I never give anyone a hard time if they say, I just can't do that, or, well, how can we take care of this? Okay, let's see what we can do. And I really care for them. And patients are great patients. I've got very long-standing patients, and I really believe that the relationships we have with them are why they're with me for so long. I won't do anything that's inappropriate, anything that financial gain isn't in it. Anything to me when it comes to making a decision that isn't moral, isn't something that you should be doing. And some things that you could do, but you just don't feel good doing. Someone comes in and says, I just want dentures, I don't want to put crowns on my teeth, or whatever, just pull them off and give me dentures. Yeah, it's an option, but I'm not going to do it. You could find other people that are willing to do that, but I just can't sleep at night. And to me, sleeping at night is very important, because you know what? All of us here feel, I like to think we feel that we have to answer to a higher power. And everything we do here is for naught if we can, when we get up to God, justify everything that we did. So that's how my faith comes into what I do. That's a lot of, it guides a lot of my decisions throughout the day. Let's see. And when I get to know my patients, I can actually help them with a lot of other things. Things that are part of me that make me want to share with my patients. I look for any opportunity I can to help them. If I can loan them things, I just had some knee surgery, and I have, we had it for my wife's knee surgery, this little ice machine and all. If someone mentioned they're having a surgery, oh, you're going to put this on your knee? I've got it. Don't buy it. I've got it for you. I'll loan it to you. Just bring it right back when you're done. I mean, I love doing things like that. Any way I can help somebody, that's part of me. That's what I like to do. Sometimes it's just sitting there and listening to them. When you have a relationship with your patients, they feel comfortable in coming to you, and sometimes unloading them. They sit in your chair, and you just know something's not right, and well, tell me about it. Instead of you numb them up, you don't want to run out of the room, go sit at your desk and look up ESPN on your computer, or whatever. You sit and you talk to them. Well, what's going on? What can I do for you? Just talk to me. Sometimes just unloading it is great. There's a lot of patients I see that are going through either layoffs, like David said, or facing cancer. They may be real serious ones. They may not be severe, but and you just listen to them. And the most powerful thing I can say to them is, well, is it okay if I include you in my prayers tonight? And, oh, really? Yeah, that would be great. And you honestly, you're praying for them, but they really feel good about it. You see an immediate reaction from them that they feel that the hope is just risen. It's just the power of even suggestion and prayer. It's pretty amazing. And I even like discussing my faith when I see an opportunity here. And this is coming on a little stronger since I've attended Curcio, which I'll get to toward the end. But every opportunity I can to show people my faith. I'll have a cross hanging in my office where they can see that I'm Catholic. In my car, I put my big Curcio sticker on the back. Hopefully somebody's going to come up and ask me someday. No one has yet, but I can have an opportunity to tell them about Curcio. If someone, I have an opportunity, I'll ask them about what do they practice, what faith do they practice, and are they strong? And I won't necessarily try and convert them all to Catholic, but I'll try and get them to practice their faith more strongly. Let them realize that, you should be devoting a little more time to God. And it makes a big difference. And they see the faith in me, and it kind of helps them a lot. I have another thing, I brought this book here, which rediscovered Catholicism, which I think is something we should be really, I gave Dennis a copy of it. And anyway, hope everyone, I really wish Father Steve would just have every parishioner have one of those to read it. But anyway, buy a case of these things and I keep it in my office. And every chance I get, I would ask a patient if I can give them a book to read. And they very rarely say no. But and hopefully they read it. I had a patient came in the other day that, I forget what led us to the conversation, but we were talking about how she was, she actually confided in me that she almost became a nun when she was young. And now here she is not even really practicing her faith. And life got in the way, and her husband wasn't a real strong man of faith, and things just kind of drifted that they weren't even going to Mass on Sundays. So I said, well, I've got a book that I'd really like you to read. So I gave her the book, and she was all excited, and she said, I definitely will read it. She promised me she'd read it, and I'm excited to wait and see, because that's since her last cleaning, so I'm waiting to see how she'll come back. And hopefully I got her back to going on Sundays and only taking off from there. So, but because of my strong faith, I'm not afraid to do that. How do I treat my staff? That's also an extension of who you are. I treat my staff as family because I really care about them, and I really believe they care about me and my family. Just like everyone else, you treat people the way you want to be treated. My mom always told me that, like I just said. There's only 7 of us in my office, including my wife and myself, and so we haven't had to hire anyone in quite a long time. So my staff really likes the way I treat them. They're wonderful people. We all get along, we work comfortably together, and we really pitch in and help each other when one of us is in need. One thing that we did for one of my staff was she had her daughter went away to college, and she fell and hit her head, and we didn't even know that she was going to make it. So she had to run off and fly to Boston and be with her, and I said, just go. Don't worry about the practice. Just go do what you have to do. I'll hire subs. I'll do whatever I have to for as long as I have to. Don't even worry about your job not being here. Take as long as you need to. She went off and did that, not worrying about her job. We ran a fundraiser where all the bleaching in the office was donated to her for her medical bills. And we raised quite a bit of money for her to help her. And it was all greatly appreciated. Her daughter's great now, and everything worked out really well. That's one instance in way I treat my employees, which I really like family. And another one, I have another one in my office has a child that of special needs, and so she needed, her husband had also passed away. It's sad, but she's very strong, and she's strong in her faith too, which helps her get along. But anyway, so she needed to come on and get benefits, and because she was going with her husband's medical benefits, and she was part-time. So Angela and I sat down and said, we really have to do something about it. So we said, okay, we'll just change the manual. We'll give part-time employees benefits. So we did that, and she had benefits. And then 6 months later, whatever, she needed to come on full-time for more income. We said, we didn't even think about it twice. Just, okay, bring her on. It was like family. So if you really deal with your co-workers like that, like Dave said, they're people. We're dealing with people. And these are people that I'm very close with. I see them, when my wife's not in the office, I see them more than I see her. So, very important. And they actually do a tremendous job, because then they wind up, that whole environment that we create in there carries on to our patients. And they really take good care of our patients. I tell them, take care of our patients. That's your number one job. They're supposed to feel comfortable here. They're supposed to feel like they want to be here, stay here. And you help out in any way to get them reimbursement from their insurance, whatever you do. And very rarely does a patient just go, pay, and walk. They're usually hanging out, showing pictures of their grandkids. It's amazing. Sometimes I'll finish with them, I'll finish with the next patient, I'll walk out. You're still here. So, it's great. I think we have a great environment in my office, and I really feel that's reflective of the way I was raised, and with strong faith in my family. They all see that my wife and I are strong in our faith and family values, and that we will consistently do the right thing. Lastly, I'd like to say a few words about Cursillo movement. I made my Cursillo in 2010, October, and I continue to work one of the 4 English-speaking Cursillos each year. At least that's all I speak. It's for all the sacrifice that you do in the 8 weeks preparation for it and the 3 days itself, the intangible rewards are far greater. What it is it's a 3-day experience which centers on the Christian ideal, presenting only the basic, fundamental things which are necessary for living life as a Christian. That's their description of it. It presents them in such a way that people can easily see how the Christian ideal relates to them in their lives. Cursillo is an amazing experience. I have some of my groupies over here that we meet every Tuesday morning and make sure that we're on track and what we learn there and keeping the faith. But to describe Cursillo in any more detail would be to, quote a great Notre Dame coach, Lou Holtz, who when trying to explain coming to Notre Dame to his recruits, he would say, if you've been here, there's no explanation is necessary. If you haven't, no explanation will suffice. And that's a great analogy for going to Cursillo. I could tell you some things about it, but unless you really experience it yourself, I can never come close to it. Since returning from Cursillo, a change in me has been noted by all who know me. I've been more patient and understanding, more outwardly expressive of my faith to others. I often attend daily Mass, pray more often, read scripture and related books, listen to spiritual CDs, and meet regularly with my fellow Cursillistas. In fact, it's the most enjoyable morning of my week. And my outlook on life is different. When adversity arises, I learn to look it in the face, take it head on, and trust everything else to God. And in fact, one of our other groupies who's not here tonight, he took it a step further. And he said, when you totally leave it in God's hands and trust in Him completely, you will not only learn to accept His will, but you will prefer it. I thought it was pretty powerful. It just caught us all by surprise, I think, to know that you just prefer whatever God chooses for you. And imagine the peace that brings you in your life. To know that everything is for a reason. And don't worry about it. Just take it on and move on. I strongly urge you to look into making Cursillo for yourself. You'll come to realize God's plan for you in your life, and that can only start with a personal transformation. Only then can we be living witness of the gospel in our own circumstances. We have a saying at Cursillo, bloom where you were planted. I think that fits into this series of talks very well. We're all planted in different professions, and we all learn to bloom where we're planted. And if you take nothing else from my talk here tonight, I'd like you to remember the words of St. Francis of Assisi. Apparently he got through a few of us. When he said, preach the gospel every day, and when necessary, use words. Thanks for listening. Any questions? No questions?
How do we find out more about Cursillo?
Actually, the St. Edward's website, I noticed there was a connection there. Yeah, so you can, or Cursillo, what is it, Cursillo.com? Or, yeah, if you did a Google search, you'd find it on there, and you would find, it's held at the diocese offices over there in Marywood.
And you know what, Frank? Rediscovered Catholicism. Actually, about 2 years ago, the moms over at St. Edward, they do a tea every year, and they gave everybody that came to that book. Yeah.
Excellent. Excellent. Yeah, definitely great reading. So.